which is called Bird. So at this point, let's put our attention and let's clap to welcome Melinda.
Thank you. It's such an honor to be with you today. And again, I'm so appreciative of seeing the beautiful culture that we've just seen. You know, so often as we live in the city, we hear people talk about what's wrong with the city, and we just saw what's right with the city. We saw the beauty of the city, right, that's on display in this place. And so we're so excited to see that today. My name is Melinda Priest, and I am a pastor, not a priest, but I'm a pastor of a church, thank you, in Jamaica Plain. I also am a site director for Immigrant Connection at Awaken City, which is a low-cost legal immigration office, a Department of Justice legal rep as well. So I have such a heart, both from the faith perspective, but also from a legal perspective of our role and what we need to do together to see a systemic change. And so today I represent not only myself, but also Unite Boston. I serve on the board at Unite Boston, which Reverend Kelly Fassett couldn't be here today. She's overseas, but she is also someone that seeks to bring together faith communities over historic divides and just say, what can we do together that we couldn't do on our own? And really, what I'm going to share with you today is something that's been going on for the last 3 years. It's a systemic, actually an opportunity that we've had through a conference called Boston Flourish, which brought together faith leaders, also business leaders, nonprofit leaders. And we said, okay, if we come together, if we sit around tables like this, let's look at 3 systemic needs in our city and how could we go forward together. And in the last 3 years, one of the obvious needs has been how do we do a better job of caring for our immigrant brothers and sisters. And one of the things that as we sat together, people across every sphere that you can imagine, people from different faith traditions, all seeking to say, we're not okay with the normal as it is. We want to see something better for our city, for our country, clearly for the world. And so we began to ask some questions together. What do we need to do to see change, systemic change in our city? And one of the most basic things is that we needed to know what one another was doing. For our immigrant-facing communities, for our faith communities that were doing amazing work, but we just didn't know what the other organizations, the other faith communities were doing. And actually, Dr. Gabo and Agencia Alpha and the Mayor's Office of Immigrant Advancement were a part of those initial conversations. And we, after that initial conversation, met together for a year. Pastor Manny, who's here for the Fellowship of Haitian Pastors as well, was a part of that conversation. We said, what can we do? And so we began to go through this process of saying, I think we need a dashboard. We need something, some way of communicating, not only on Google, but to be able to quickly, real time, if I'm sitting in front of a congregant, or if I'm sitting in front of a client, to say, I might have something that they need. I can help them with some of their legal care. But what if they need diapers? And this is a real life experience. I was sitting a few years ago with a client who not only needed legal care, but she also needed diapers and food. And guess what I did? I called Dr. Gabo, she's in Mattapan, so right around the corner, and I said, can I send someone to pick up some diapers and a gift card? And she said yes, right? And because we had built that relational equity. But over time, as we began to sit together in circles like this, we realized there are so many things that we can share together. In our last meeting, we talked about the difference between scarcity and abundance. And in this room, there is abundance if we can share with one another, right? And so let's do that. And so we began to say, okay, how do we provide a real-time, up-to-date, available services for legal aid, for ESOL classes, for workforce development? We're also adding education and housing services so that we can collaborate and connect with each other in a more efficient way. This is a secure platform, and right now this is intended for immigrant-facing providers. And you will in just a second be allowed to be, you'll give a QR code because we are asking you to get onboarded to this so that we can have a greater diversity on this dashboard. And again, you saw us around tables for years doing this. And so where we are today is we thank God for amazing foundations like Imago Dei who helped to fund this effort. So thank you. I think they're in the room. So excited for that. And they allowed us to start this dashboard project. And Richard Tang, who is actually over at the computer right now, I'm going to, in just a second, put the microphone in front of him, because he is our developer. And where we are right now is in phase 1 of the development, where we're onboarding immigrant-facing institutions, nonprofits, and churches. So if you maybe you don't have a service that you provide, but you serve a lot of immigrants, you can be a community partner and get access. So if you're with a congregant and you're wondering, where's the closest ESOL class? You can find out in an instant, okay? So that's the kind of project that we're working on. One of the things that we're working on, and just believe with our whole heart, especially in the faith community, is that it's one thing to have private faith, but our private faith better be congruent with our public witness. And so we're trying to say, how do we do that together, right? And I'm so honored. I really quickly, before we go to that, I just have to say, as we are hearing about mental health, I also have 2 adopted children, and my Yvette is in the room. I just saw her. Yvette was a principal of my 19-year-old son who graduated from Boston Public Schools. Amen. But when he was in 6th grade, he was in crisis. And it was Yvette, who I walked into the school, broken mom, who took my child in. So we are a family, and the reason he graduated today is because of her. So I'm so grateful. Okay. So Richard is going to take the mic and explain the platform to you just a little bit, and then ask you to onboard.
Okay. All right, hi, my name is Rich. Thank you for the introduction. It's great to be a part of this. So right now, I will just try to give you a quick demo. This is a functioning, secure website. I will leave this QR. Let's go. Okay. Okay, thank you. Sorry. So I will leave this QR code at the end, so you can scan it. You can scan it right now while I'm talking to you. But yeah, this is the public-facing website before you log in. We made sure all organizations or providers listed in services are behind the login. So if you're interested to join, we just ask you to fill out MOU. Essentially, just a questionnaire. It gives us a sense of how you plan to use it. Do you plan to list services? If you do, you get a provider role. If not, if you just want to be a community participant, we call it a viewer role, so you can view all the services. So here we have, just a rundown, the About Bird, some FAQs, and this is the Contact Us form, which is what that QR code would bring you to. So let me just log in. Apologies for that. It's a little hard to see from here. All right, my apologies. I can't see anything on the laptop, so it's kind of hard to see the projector. Okay, thank you. All right, now we should be good to go. So after you log in, you'll see everything above this horizontal divider up here. So I'll show the providers map first. It's a Google Maps plugin underneath. You can search. So this lists all providers that we have so far. I think we have about 15. Functions just like Google Maps. You can click, get info, and pretty much all the fields are searchable that you see here. And you can say, filter on service type. We'll do ESOL. and it'll just filter out, it'll show all organizations that or providers that do offer ESOL services. We'll go to now the providers list. So this is just in list form. Each provider will have a card summary of all the info. And then you can, sorry, I'm struggling a little bit with the scroll button here. There we go. And again, search and filtering works here. Once you're onboarded, you can click Add Provider to add your organization. It'll just bring up a pretty basic form here, fill your info. We won't go through that, but just show that it's easy. Just look at one of the provider's details. And then if you click on one of these, you get the provider details. We have, this one has a lot of service types. I'll talk about that in a little bit. It essentially functions, if anyone uses labels in Gmail, it functions like that. You can put multiple service types or tags on your organization or services. Here's where you would edit, oops, sorry. Here's where you'd edit. And then it'll list the services offered by just this provider, since we're on the provider details page. Here you can add a service, and just the name of the service, a service type. I won't fill this out right now, but the status I'll point out, you can say open, closed, waitlist, or contact provider. And we want to provide flexibility so that if you want to route people to your website to say register for something, you can put an optional website link here. And this is the list for one provider. I'll go to the now services list, which is all services offered by all providers registered in our system so far. And again, filtering, searching works how you would expect it to. It's a bit of a wide page. There's a lot of info here, but that way you can see the description.
Why Richard is there for just a second. One of the unique thing about this dashboard is that it's got green and red. So if, let's say, for instance, we have a citizenship class in conversational English, and if our classes are open, if you can still send people to us, it'll be green. If we've already filled them, it'll be red. Because so many times we have clients or congregants who are looking for something, and we send them to that service, and there's no open slots. Okay, so that's one thing that's really unique about this, is that we're asking the different organizations to keep it real time so that we're able to know, is it open or is it closed?
All right, thanks, Melinda. And I'll just jump over to the tutorial help guide. This, you can get step-by-step instructions for everything you can do in the system, or if you really don't want to read all this text, you can just watch a video of how you can get to things in the system. And then if you ever run into issues, for example, as Melinda mentioned before, we focused on workforce development, legal, but as we went, some organizations, we actually provide other services like food or clothing. So if you don't see a service type you need, you can just click this form over here, fill out, just say you want to request a new service type. I'll see this within a day. It's an easy update to add a service type. So I can fill it out. Or if you need generic support help, see a bug, you have a suggestion, you can also fill this form out. We'll see that within a day. And I think that was the bulk of it. Oh, I should emphasize this is a secure system, which is why I require the login. Sits on Amazon Web Services, so it would only ever go down if Amazon has a problem, which it did once, but it is safe and secure. And one thing I did forget to mention is we have a messaging, referral or messaging service here where, let me scroll to the right. If you want to refer a client for this, you can click here and then message that provider specifically. And it'll fill out the provider and service you're targeting, and then a message. We want to be really careful about any sensitive information, so we're not requiring like a name or email or phone number. So we just have a generic message box here saying, oh, I have a client that needs help with the service that you offer. Did I miss something, Melinda?
Thank you so much. Could you put the QR code back up?
Oh, yes.
But again, this is only meaningful if we have all of you. So there is more than 15 providers, clearly, in the city. And so we really, really need your help getting onboarded, getting yourself onboarded. Richard will meet with you over Zoom, have a conversation if you have any problems with getting on board. And I also just want to state, this is the first iteration of this. We are working with Boston Spark, BU, Spark students who are developing kind of the next iteration to continue to make it more user-friendly and more accessible to all of you. So we just hope that this connects us to one another and helps to build, make the city just more beautiful.
Thank you, thank you. Reverend Melinda. So again, that's what we do. We bring all of the providers, we bring the resources, but we want you to do the follow-up. Because again, as Reverend Melinda said, if we do not use it, people will not be able to, access those services. So again, make sure that you have the QR code. Is it only for Boston or because I have people from, okay, for the greater, Boston area. So again, please do click on the QR code and share it with your network because again, we want this to be, useful to all of you. So the next group that we're going to have is from the city of Boston. Come on in, come on in. And as the city of Boston Energy Saver is coming, we are asking all of the facilitators to be ready because we're going to call on you to come. And we're asking the back to please keep the voice down so that Miss Ruth, please have them to be a little bit quieter so that we can pay attention to the presenter. Thank you, thank you.
Good afternoon, everybody. I am Brooks Winter. I'm the director who was really stressed out this winter, struggling to pay their bills. Yeah. So that is a huge problem right now. It's a super cold winter, and energy costs have probably never been higher here in Massachusetts than they are now. So our program, Boston Energy Saver, is here to help with that. With that, I'll turn it over to Deegan Larkin and Paulina Diefenbach from my team.
Hi, everybody. My name is Paulina Diefenbach. I use she, her pronouns. I am part of the Boston Energy Saver team.
Hi, everybody. Deegan Larkin, also use she, her pronouns, also part of the Boston Energy Saver team. Really glad to be here to talk about this program with you all. Yeah. Thank you all for bearing with us. So really excited to talk about this program. As Brooks mentioned, this program is focused on supporting residents, primarily in Boston. We are with the city of Boston, connecting them with energy-saving resources. There's so many great programs that are out there and available to help residents, that's renters, homeowners, small business owners, save on their energy bills, get on payment plans, get discount rates that they are eligible for, get fuel assistance and support on their heating costs, and even make their homes comfier and more energy efficient. But that's kind of the problem. There's so many programs out there, and we understand that they don't all have the same amount of language access support. They can be a little bit tricky to navigate, use really technical language, and that's why the city of Boston created this Energy Saver program so that we can take that administrative burden off of residents. You can call our team and we'll help you figure out which programs work for you and how to get your foot in the door. Yes, I kind of already mentioned this. There are many programs out there. So what is the Boston Energy Saver program? We are a help desk service. So you call Boston Energy Saver. You're calling me, Paulina Brooks, and my colleague Maria, who's not here today. And we walk you through what programs you may qualify for. We help you get set up with next steps so that you can save on your energy bills. And then we provide ongoing support because we know that typically it's not just 5 minutes to enroll in an energy saving program. There's a lot of follow-up steps that are involved. That's where people tend to drop off or lose support. We're here to provide that ongoing one-on-one support. So all that we ask is that if residents want to participate, they give us a call, 617-635-SAVE. We have a really fun phone number that you can remember. Or you log on to our website and you schedule a consultation with us ahead of time. We are so lucky with the city of Boston to have interpretation services. So when folks call us, we can call up our language line and provide support. We have Spanish speakers on our team as well. Paulina is able to answer the phone and speak in Spanish with clients who speak that language. So who is this program for? I kind of already said it. Literally anybody in Boston. If you are a resident, if you own a property in Boston, if you are a small business owner, If you are a renter, a lot of times renters feel like these programs are not for them. They can't make, major changes to the building that they're living in. Actually, all of our team is renters, so we totally get that. And there are programs out there for you. So we're there to help connect you with energy efficiency, energy reduction programs that you qualify for, and also provide support talking to your landlord if that's something that you're open to. We can be that kind of liaison that talks to the landlord, explains why energy saving programs are so important. So these energy programs that we're talking about are programs like Mass Save. You may have heard of that program. It provides energy efficiency upgrades for homes and businesses, things like insulation in your walls so that it's not so chilly and drafty. Heating system replacements. A lot of us in Massachusetts are still on fossil fuels like gas and oil. That leads to pollution. It harms the air quality in our neighborhoods and isn't always the most comfortable heating system. There's newer technology out there that runs on electricity, is much healthier for our communities, and also can improve comfort. We help people get connected with that when that's the right heating source for them. We call those heat pumps. So we talk to people about how they can save money on their bills, make their homes more comfortable with energy efficiency upgrades, and then make their communities and their space healthier, taking out things that, like fossil fuels, that can reduce the air quality in somebody's home. So I'll turn it over to Paulina, who's going to talk about the specific measures that we can connect people with through the Energy Saver program.
All right, so a lot of our housing in Massachusetts and in Boston is quite old. It may feel normal to be really cold at home in the winter, or to feel like your windows are a little drafty, but there are many resources that we can connect you to be able to improve comfort at home, as well as help you manage your energy bill. If you have people in your network or those that are connected to your organization that are reaching out about high energy bills and balancing the cost of like food and childcare or medical costs on top of a high winter bill like Brooks was talking about, please call us. We are also connecting people to rebates in case you need to replace an old appliance like a water heater or a stove. Just make healthier choices for your home in a way that feels accessible and that you will have the support that you need. The other reason why we're here is because we have the privilege of working with IFSI, who is putting their trust in our program and our team to reach communities like Mattapan, Roxbury, Dorchester, that have long been underserved by government services. And so if you have people in your network that may benefit from Boston Energy Saver, please reach out to us. We would love to continue to expand our partners network. We're currently working with a lot of groups that are not just environmentally focused. We believe that everyone should have a comfortable and affordable home and want to make that a reality for as many people as possible. And we're also doing it in fun, engaging ways, eating around food and in places that are trusted by communities. We'll have interpretation available at events and just offering to take a look at someone's bill. So if you have any further questions, please reach out to us. We are really excited to bring on more new partners and ensure that everyone knows about these services and that everyone can have the support that they need to run a comfortable and healthy home.
I'll also just say we are here. We have a table in the back, so if you want some of our snazzy handouts in Haitian Creole, English, Spanish, Vietnamese, please come find us. We're back near the registration table.
Thank you. Great job. I mean, I have to say that this year, my husband complained so much. He said, I don't understand what's going on. Those bills keeps on, getting higher and higher. So I'm glad that you're here. Where's my husband? Husband, do go to them and say what's going on with our bill. All right, thank you, I appreciate it. All right, okay. So now it's our time to really bring our different leaders, facilitators, whoever was taking notes in the different breakout room as a way for us to hear what was discussed and then what we're going to do about it. And remember, we take the notes seriously. If you are with us, every time that we meet, we share with you, the report of the symposium. So your notes, we take them seriously. That's the reason why on each breakout room we have someone to take notes and to share those notes with us, because we're going to compile all of that and to make it like a big report for all of you. Because even if you are in the workforce, you probably want to know what's going on in the mental health or in other sectors. You can read those reports and then help you understand how to go about that. So again, thank you to all of us, to all of you who were in those breakout rooms. So Jennifer, how do we proceed? Who is going to be first to go?
So first up, in terms of shareback, I know that did everyone designate a person who would actually share back for your team? Yeah? Yeah? So I can volunteer someone to go, or does any particular breakout session, would you like to go first? Okay, so youth and education, because mental health's all the way in the back, it's going to take you some time to walk. So I'll start with youth education, who's right here, and then, oh wow, it's an all-out war. So let me start with youth education over here. So I'm going to invite Daphne Germain to come and do a share back, and each team will have about 3 to 4 minutes to share back the major takeaways of. And just as a reminder, we will be sharing that full report, but the goal is to talk about what were some of the things that we're expecting, and then what are some of the ways that we are looking to change the situation.
Thank you, Madame Raymond. Good afternoon, everyone. My name is Reverend Daphne Germain LaRoche. I am a representation of the Massachusetts Association of Haitian Parents. Long name, but the fight stays. We thank Dr. Gabo and everyone who has helped make this event a continued activity. For the youth in education, this is our 3rd time. We present in partnership with my colleague who was not able to stay because she is a mom who had to go pick up her babies. Dr. Regine Filippo, she is the founder of Dessalines Academy, which is a micro school that also teaches in Haitian Creole. But it is leading access to STEAM education on behalf of our Black, brown communities. So again, if you're looking for an opportunity, check out Dessalines STEAM Academy. Thank you, Dr. Gabo. The true representation of how our community works. You see something, you do something, right? So for youth in education, as I said, this is our 3rd time coming together, and every year what we've done is we've built on top of what we have learned. So it's not just in a workshop, but it is an opportunity for us to continue developing what we're defining as an educational platform for our community across the state of Massachusetts. And this year, what we wanted to do is in follow-up to the things that we identified last year. Last year, we wanted to focus on external advocacy. Well, the platform that we're building had identified external advocacy around equitable enrollment, access for supports for newcomer bilingual programmings, access to language services, and wraparound services for our community based on the increased number of migrants that we had been dealing at that time, and then also internally to build our capacity. A lot of our community-based organizations that are doing this work are led by people who are 14 different hats. Most of the time, the work we're doing, we leave our full-time job to volunteer to do the work that we're doing. Do y'all understand that? Some of y'all are paid to be here because that's part of your job, but the people who are mostly leading the work are people who volunteer on top of the other work that they're doing. So one of the things we said is we need to advocate to increase resources that come into front-facing organizations so that the people who are doing the job can actually do it full-time. Then we talked about developing scholarship opportunities and career pathways for our children, and then family and leadership engagement. What we identified of things that actually worked for us, we give a shout out to Mass Advocate, who spearheaded IFSI True Alliance and MHP, we signed on board to ensure that the Protect Education Equity Bill became a law. How many of y'all know now it is a right for our children, regardless of immigration status? Because some schools did not know that they should not, ask that question, and our kids were being denied access to K-12 education. Now it's coded in law. And also it provides standardization for interpretation by making sure that interpreters are trained to be able to provide services. A lot of stuff. And also a shout out to Haitian American Chamber of Commerce that launched a scholarship fund for our babies. And so we want to say thank you. So a lot of work has been done by community-based organizations. Today, what our community talked about, like, what are we not happy with and where we can build and advocate for social emotional support. All right, the mental health crisis is real. One of the things we talked about is that our educators are actually frontline triage operators. Teachers in the school are hearing, because they develop trust with the families, they're hearing all the problems. I can't pay my bill. I'm getting evicted. So not only are they taking care of the children, but the parents also connect with them for all resources. So how do we ensure that our educators have access to something like BIRD, that the school districts understand that these resources are available, and that the teachers don't have to figure it out? Because that's a stress too, when you, as an educator, when you have to figure it out. The other one is, what was brought up is the continued trauma situation. Because of the situation of our family, a silent problem is around sexual violence. Because now people don't know what's going to happen. People are out of work. There's this quid pro quo. I'll cover the rent for you if. Or that, well, I kind of like your underage daughter or son if you allow me access, ... right? That's the wrong storyline. My 3 minutes are up. Dr. Gabo, I'm wrapping up the thought. But this is an issue right now that we're not talking about. For the migrants who stay and don't have access to anyone, and they don't know that of their rights, they are now open towards sexual violence. And that's a real thing we don't talk about in our community. And then we also talked about accountability around data systems. One of the things we want to do in 6 months is we want to convene for education about launching a task force that just talks about accountability and how do we move forward with these supports. There was one more page, but we'll make sure that's written in the report. But what we just want to say is the real problem out there is that people are exhausted and tired. The trauma replicates. The secondhand trauma, frontline workers are real. And so mental health support is not just about speaking to a counselor, but it is helping restate the adage of, I am enough in this moment. I can't carry anymore. I'm doing as much as I can. It's okay if I don't take one more thing on top of my head. I can just breathe because what I'm doing is enough. And that was a storyline that we also talked about. How do we get that out to our families and our communities? Thank you.
Powerful, powerful. So, which is a great segue to the mental health group that we are invited to come forward. You see, when you come, there are things that you learn that you are not even paying attention to, right? I can do X, Y, Z for you if you. And we probably were not aware of those situations going on around us. But as we come and we listen, we can, pay attention to this. And remember, the report will be coming out probably in the next 2 weeks. So be in the lookout for the report. If we don't have your email, make sure that you leave your email today so that you can read the full report for each of the sector. So this group, I'm telling you, this is our, I don't know how to call this group because they've been meeting all year long. To today, okay? We can clap for them. They've been doing a lot of work. So glad to have you guys.
Good afternoon. Schoon Carrington here. I am with the New American Association of Massachusetts and also proud MIRA member, and also I'm here with the Mental Health Task Force. I am looking at the clock, so I'm gonna really try to model and stick to the time. And then I'll pass it along to Tracy to introduce herself.
Tracy Talden, hi everybody. I'm a mental health clinician here wearing many hats, but most importantly, part of the Behavioral Health Task Force.
So for our discussion, because mental health is fairly broad, we focused on 3 different areas. So the first one was in charting forward, what are some of the strategic partnerships that people have either developed, currently have. We also focused on any new or innovative pilot programs that people may be putting together or thinking about. And then lastly, because we were talking about youth mental health, what are some youth mental health outreach and programs that people are focusing on?
Really quickly, just to give a little bit of context, last year when we met, we came together as providers and we developed the Behavioral Health Task Force. So all year we've been meeting, Dr. Gabo was just referencing that, we've been meeting and working with other providers in the community across the state, really trying to come together and pool resources and collaborate.
So, in terms of strategic partnership, I am not going to read everything that's here, but since you're going to have the report, you could go over them. Natural strategic partners, the city, state services, so Boston Public School, people discuss some of the partnership that is there, DTA, and new partnership like partnering with the churches. So I think that was one of the new and innovative programs. And then also creatives. So there are people doing just art and holistic sort of like outreach, so natural partners to that. And in terms of new pilot program, there are people leveraging full continuum of behavioral health. Tracy?
Creating and recreating community for families is really important as a baseline before we start working with people in terms of their mental health. And going back to the creatives really quickly, there are programs, I think Save Souls specifically, talking about working with creatives in the community to provide psychoeducation to youth. So that was an innovative way to kind of do that.
So churches, barbershops, and those new program. And then lastly, in terms of like youth mental health program and outreach with 1 minute and 14 seconds left.
So there's just still a continued need. We identified continued needs and places and strategies that we need to kind of really tackle to move forward. We continue to need support, financial support for career development to meet the needs of the community. So thinking about not just the clinicians, but other advocates that we can kind of help develop their skills. Behavioral Health Task Force, of course, working with us, and also continuing to work with Mass Health to bridge the gap between coverage and being able to provide the services.
If you took away anything from anything that we said, there is a behavioral health task force. So if you are a clinician, a provider who have partnered with anyone in the community, join the task force so we could also have an additional list of resources and you could network. And then the task force has a bunch of events that we put together and partner with communities throughout the year, and you'll be able to join us. So we're gonna put the QR code, take out your phone to join the task force. So if you took away anything from what we said here, join the task force. And then we'll be here as well. So if you wanna network, exchange information and all that stuff, so we could tell you a lot more about it with less than 4 minutes. Thank you.
Sorry. This QR code will also help you look at the directory, the Mental Health Network directory that has a slew of community providers, organizations, and different types of services for immigrant communities, not just the Haitian community. So if you need something, if you're working with families that need a resource or something, look there.
So thank you, Mental Health. And again, like I said, since last year, they've been working together, and we want to see the same thing for all of the other sectors to continue to work together, because the behavioral group that they put came out of those meetings, the need for us to do that. So thank you so much for doing that. So who is coming next, Ms. Jennifer? Healthcare group. We have, I saw BMC here, right? Healthcare, where are you? Where is BMC? Oh, they have to separate? Okay, all right. Okay, so in this case, let's do the workforce. Workforce development, yes. Very important, yes.
Hi, I'm Amy from JVS. We are the awesome workforce development team at this table. So what's it like out there right now? It is very hard to both get a job or help other people get a job. Why? Well, people aren't able to attend class or go to job training, and this is for lots of reasons. Obviously, the fear of ICE is happening, but also some of our clients are moving away, like to Canada, and sometimes people need to take extra shifts because they're really worried about what's about to happen. There's a lot of misinformation out there. State agencies like Mass Hire are feeling concerned that clients mistakenly think that they will connect them to ICE, and employers have a huge misunderstanding about who is eligible for work right now and who is not. The immigration changes have been both confusing and problematic when people's work permits expire, or employers are hesitant to hire people because they're worried that their work permits are going to expire. The ESOL system is not right now set up to prepare our clients to go to work. We need more ESOL classes. We need ESOL that's connected to job training, and we need ESOL that is much more flexible. There are barriers to people doing job training programs, like needing a photo ID or needing a physical, but they're not connected to a provider. Job placements are just harder right now. Employers are misinformed and hesitant to hire. Employers require a lot higher English than they used to. And hiring an employee requires so much technology. Like, all the applications are online, and clients have to be able to navigate that or check their email or be able to respond to an attachment. And employers are using a lot of AI right now instead of staff, so it's harder for people like us to build relationships and say things like, oh, you should meet this client, they're awesome, because there's no one to say that to, because right now it's a bot. And clients need a lot more work readiness before they're ready to do. What will happen and where are we heading? Well, we're really worried about a lot of things, like homelessness, like the mental health crisis that's happening for our clients, including depression and suicide. We're worried about an increase in crime because people are doing things like shoplifting in order to get their basic needs met. And we're worried about gaps in our communities, including our neighbors, our sports teams, our store owners, and the kids who sit next to us in class. And lastly, what are we going to do to make this all better? We need immigration reform right now. We need to encourage funders to be a lot more flexible with us and to change the way that they do things. We need universal health care and affordable housing. There's so much that's tied into getting people jobs, which includes like all of the safety net services. If people can't focus on their basic needs, they definitely can't go to work. We need childcare in non-traditional hours, and actually we need increased access to affordable, safe, accessible, and quality childcare. We need innovative programs that meet students where they're at and understand who they are right now, what their goal is, and how to help them reach that goal. We need ESOL that's integrated into job training, and we need workplace readiness classes.
Wow, that was very good. Solid. Wonderful. So again, to all of you in the room, you heard, what we need for people to go to work. So as you are thinking about, as you are hearing about that, when you go to your workplace, when you talk to funders, you know exactly what to tell them, and that's the reason why we're doing what we are doing. Thank you, Amy. Really appreciate it. So now we're moving to social services, faith-based. I think they're all together, right? Yes. Philanthropic, yes. All right. Let's clap for them. Come on. Remember, the report will be coming out shortly. And please do not leave until the end, because we have, the biggest fun is when we do the nice picture to start to show exactly everyone who has been here for the day. So please wait for that picture, because this is historic, right? We're going to put it, on our website. So thank you.
Okay, we were the group on faith-based, philanthropic, and social services. And the things that we highlighted in that discussion were really the biggest word that came out was collaboration, that this is an opportunity for us to learn how to collaborate with each other. And to do that, that has to be rooted in relationship. So throughout our whole discussion, those were the concepts that kept coming back up: collaboration and relationship. It also became clear that this was a time that the faith-based communities could really show some leadership and really start initiatives from faith-based communities that could be really important for supporting immigrant communities right now. And we had one example of that in the dashboard, which you just saw, and had the QR code to sign up for. We also got the clear message that people want to be active right now. They want to be involved, and they don't always know how. So connecting people to useful ways for them to be involved in supporting the immigrant community was very important. Also, the need to learn from one another, because people are working in different areas, and we don't want people to be siloed, and we don't want issues to be siloed. So there are a lot of needs that came up: needs for mental health services, emotional healing spaces, financial assistance. And there were some foundations in the room who were talking about the need to understand this work and to fund this work, and also the need to fund collaborations, because that takes staff time, that takes effort. So it doesn't automatically happen. In the future, people wanted to see a future of abundance and empowerment, and the need to break down silos, to find collective actions so that we could be working together and building relationships while in action, and the need to consciously work on breaking down segregated areas, segregated demographics, places where people no longer interact, and that the way that we fight back is by breaking down those silos and those situations.
Wow, good job, good job. And I always talk about the role of the churches, you know, in this crisis. So the more that the churches can be present. I know that I have a lot of ministers, priests in this room, but this is the time for churches to be present. And yes, and for them to create what we call the healing space for people to come. So believe it or not, the dancing group that you saw, most of them are newcomers, and they were going through so much, and we were like, what do we do? How do we support them? How do we? So they came up with this idea that we love to dance. That's what we do in our country. So why can't we come together and dance? So again, the dance is a healing space for them. They are learning English, but at the same time, they are enjoying each other's company. And I can tell you, this has helped them a lot with their stress level, high blood pressure, all of those high numbers that you know. So again, creating those spaces for people to come and, you know, dance, sing, play, all of those things are important, especially right now. And that's the reason I'm calling all of my faith-based leaders to be very intentional about creating space for the community, for their members, because this is really needed right now. All right, so I'm so glad that we are moving very fast. The next group is legal. All my, heavy duty. I'm telling you, this is a time where my legal people, they don't rest, they cannot rest. So again, let's listen. And right after legal, we're going to have healthcare, okay. And then we are so happy to have our, powerful, wonderful, city councilor at large. Wood's Illusion will come with us at the end to speak about a few initiatives that we are doing at the city of Boston, especially at the city council. All right.
Thank you, and thank you to everybody who participated in the legal and advocacy section. We started out by talking about what we're seeing in our work and really tried to focus the conversation on what we're seeing now that's different. Because as we know, immigration law has always been extremely challenging. So we really wanted to focus on things that are different that we hadn't seen previously. We talked about how immigration judges are issuing much higher bonds for individuals that are detained, even $20,000, $30,000, $50,000 bonds are being issued by immigration judges, and those are the ones that are being granted. We're also seeing a much lower number of bonds being granted by the court in general, and people are subject to mandatory detention. People are choosing to deport because they don't want to stay. We talked about how difficult it is for individuals, even lawful permanent residents, to move along their cases because there's a pause in adjudications, especially from the travel ban countries, and how that's unheard of. We've never seen that before. Asylum applications at the asylum office are not being adjudicated. What else? The family separation, obviously, the violation of laws, the pause in applications. School absences, children aren't going to school because they're afraid of ICE, fewer pathways for work authorization and how expensive the process is. Obviously, a lot more individuals who are being detained, and what we're seeing in that sense, our 3 branches of government are being reduced to just 1. There's only 1 branch of government. The government, the administration is not following judicial orders. Congress is silent. They're not stepping up. They're not stopping what's happening. We're seeing an increase in notarial frauds, and obviously dehumanization. And that was a comment that was brought up by this group. We think this is new. We talk about how this is different, how this is not something we've seen before, but actually this country, as of very recently allowed slavery. Slavery was emancipated. Slavery ended in 1865. That was only 161 years ago. That is not a very long time. So when we talk about these things being new or different, or rights being violated, or people being dehumanized, this is unfortunately very not new. From there, we went on to talk about something a little bit more depressing. If nothing changes, what future or reality do you anticipate? And unfortunately, I think there's a collective feeling that things are only going to get worse. We're headed into a more fascist, authoritarian country. Unfortunately, we're seeing it every single day. We're being told not to believe our eyes, but we can see what's happening. People are experiencing it. One positive, the only constant thing that we're seeing is change. There is something that we can do about this. Things may get worse, but it's not going to stay this way. So hopefully, people will take action. If unfortunately, maybe we do need things to get this bad for people to see it, because we are headed in a direction where the country will fall apart. We are a country that is, we work because of immigrants. It is immigrants that make the economy move. We are 100% dependent on immigrants for farming, for every industry, every area, in every way. So if we continue in this path, the country is going to fall apart. So hopefully that will lead us to put a stop to this. Protesting works. Everybody agreed on that. There is a No Kings rally on March 28th, so encouraging everybody to attend. What else? There's a lot of misinformation, and we want to make sure that immigrants especially are amplifying their voices. We did talk about the difficulty for some individuals who feel afraid, whose status isn't secure in this country, to be out there and to be fighting. And so we want to make sure that it is safe for everybody, but recognizing that it is not safe for everybody to be out there. So with gratitude to everybody here who is coming together collectively trying to make a difference. I know we're running out of time. I'll end with something positive. What can we do individually and collectively? And again, protesting is right up there. And what is our hope for this sector? What do we think we can certainly show up. We can be in solidarity. Everybody has a piece to play. Oh, somebody said if you can't show up, give money. I think that there are a lot of organizations out there who would be very grateful for your donations if you cannot be there in person. What is your hope? We are coming together to support each other, so it's important that we not stay silent, that we stay strong. Very important to remember, love is the only thing that's real. So many people have volunteered. There are thousands, hundreds of thousands of individuals who have come together to volunteer. There's a hope for the future. The Republicans and Democrats can come together. That is more hopeful than I feel, but hopefully some of you think that. Oh, there's this beautiful phrase that I cannot read, but somebody who's Haitian can perhaps say it. Haitian Creole, excuse me. Sorry, I'm very nervous.
Mais en pile, charge pas lourd.
Thank you, and that means.
Many hands makes the load light.
So thank you very much. Appreciate being here with all of you. And again, there is hope, there is a future, and that's it. So thank you.
Yes, there is hope, and we cannot lose hope. Thank you, good job, good job. But remember, again, we're going to get all of the notes, soon, because we're going to send the report. So let's move quickly to the healthcare, come on. Yes.
Hi, we're medical case managers representing BMC here today, but we thank everyone that had a great conversation with us in our breakout group here. We didn't make it very far past the first question because there's a lot of barriers. Yeah, but we're going to share a little bit about that and then how we're going to move forward. So,
my name is Kalihidan. I'm also a medical case manager at Boston Medical Center for refugee health. We've discussed about like the barriers that immigrants face when they're trying to access healthcare in Massachusetts. And the first thing is Mass Health Limited. Yay! That is the first barrier that a lot of patients actually face, and trying to understand what actually that insurance covers for them and how they can enroll in that system in the first place. That is a big barrier that they face. And another thing is language. Just calling insurance and talking to them about like what type of healthcare insurance that they need for their services is very daunting. And that's why we have medical case managers at Boston Medical Center to actually guide them and speak on their behalf and advocate on their behalf. And then the third thing that we discussed about is the lack of medical case managers or healthcare workers within the system, within the healthcare system, which means that a lot of patients are kind of left on their own, or a computer or like a piece of paper just given to them by providers to pretty much figure the healthcare system on their own, which is very scary for a lot of patients. And that is the biggest problem that we have seen as a barrier. And
yeah, and I can share a bit more about the rest of our conversation. We spoke about how important it is to be always conscious about what our patients are experiencing when we hand off a referral. When we hand off a referral, I think in the 30 minutes that we meet with our patients, it seems so simple. Here are the resources, here's the education, these are the steps, and at the end, you're gonna hopefully feel better, but that's not the reality, because we're just another person giving someone the runaround in the healthcare system, and it sucks. So always being patient with ourselves as healthcare workers and supporting our patients, but also always being conscious about how our patients are constantly running around this city, running around Massachusetts, finding out transportation, who's the right person to contact, and going through all these systems. And as representatives from BMC, we're incredibly conscious about that and supporting our patients as a small team that we are. We only work with about like 5 other case managers, and we're all trying our best. And as we move forward, we spoke about always speaking up, supporting each other, and being confident as healthcare providers and giving information to our patients. And if we have a referral to give, what are those steps? What are the limits of that health insurance? Being realistic with patients, being honest, because it's not easy to just being told misinformation. But yeah, so being honest with ourselves in our work and being compassionate and continuing to engage the best that we can.
I guess just one important thing that I also want to add is we're not just like an in-house care. We like to collaborate with our community partners. So you guys are our community partners. You guys are the people that, or the organizations that we send our patients to for housing, legal assistance, for other like transportation needs or insurance. So we rely on our community partners, and we want to be like, we want to connect with you guys. We want to have that seamless referral process so that our patients will not fall through the cracks. So yeah, we need that. Thank you.
Wonderful. Again, great job. Collaboration, collaboration. They are here. Please be in touch so we know exactly, how to support our patients, because that's the reason why they are here. So, and they have flyers on the table. They have information. They have QR codes. Please do take advantage of that. So quickly, before I call on our consular, I want to invite Lenita from the Brazilian Workers Center to come forward, because there is something very important for us to remember. During this time of crisis, there is a lot going on for our employees with our employers. So Lenita, talk to us a little bit about what's going on.
Good afternoon. Boa tarde. Okay. Unfortunately, we have been seeing that employers, NSI, so as Dr. Abel said, the Brazilian Workers Center, we have been doing workers' rights for over 30 years. We're going to be 31 years in May. And we do see many cases of wage complaints during the year. We do workshops, workers' rights workshop every other week for workers. Regardless, immigration status, where you come from. At the Brazilian Workers Center, we speak 5 languages: Portuguese, Spanish, English, Haitian Creole, 5, another one, and French, some French, yes. I'm trying to count. I forgot how to count yet. So recently, we work on a case. Soon you're going to see on the press that's over $1 million stole from workers. And this was workers that was working with a law firm. They have, they could speak up for themselves. They was non-documented. There was paralegals. So it's just you see that's not something that happened only with immigrant that doesn't speak English, that doesn't have status. That happen everywhere. And what we're seeing right now is employers threatening to call ICE because they know ICE now is more threatening than ever. In the past, when someone said, "Oh, we're going to call ICE," we was like, "Go ahead, call ICE," right? But now the employers know. So every time we call employers saying that we have a wage complaint, they said, "Okay, I'm going to call ICE." So I want to let you know that's very important for everyone that is here that know, regardless of immigration status, you do have rights. Under the labor laws, if you worked, you have the right to get paid. And we work close with the Fair Labor Division of the Attorney General's Office. We do open complaints, and in some cases, even I know people have a fear to report, but in some cases, you can have a chance to, after you complain your case, maybe you are eligible for something else, for some relief, immigration relief, because we see many cases of trafficking. Usually people talk about trafficking for sex workers, but we haven't seen over and over again for workforce. So that's all I can say. If you want to know more about the work we do in collaboration with Dr. Gabal and other organizations, just check our website or talk to us right there on the table. Thank you.
Thank you. Good job. Yeah, because again, there is something going on around there where whenever there is an employee who goes and complains to an employer, before you know it, it's a threat. If you say this, if you say that, we are going to call ICE on you. So it's important for all of you to know those things that are happening so we can protect those people who are under our care. Now, let me have my dynamic and wonderful, although she had a long day of hearing, but she still made it here. So come on, our Councillor Woodsy Louis-Jean.
Hi, everyone. I'm so happy that I could join you Dr. Gabo didn't really give me a choice. She was like, you're coming after your hearing. I was like, okay. But I just want to say thank you to everyone in this room. I know, like, I literally carry the weight of this moment in the way that I know so many of us do and understand how hard this is, how heavy it is. I try not to dwell on the fact of, like, what if things were different? We'd be fighting fights, but they'd be different fights. And so the hatred and the xenophobia and the white supremacy that forces us to fight these fights for people who want nothing else to do than go to work, make sure their kids can go to school, send some money back home. So I just want to say thank you, because this work is not easy. And we're all carrying it in different ways, either personally or through the work that we do on behalf of others. So I just wanted everyone to clap for themselves for the work that you all have been doing. So I'm Ruth Louisiane. I'm an at-large city councilor in the city of Boston, the first Haitian American on the Boston City Council, and just grateful that I get to do this work. And I have a text chain with Dr. Gabo and Pastor Kiki for the past, we've been texting every day. And I'm so grateful to have them as partners in this work, because I don't know, like, I feel like I'm not alone. And that we have a good inside-outside game. And so I'm just grateful for your partnership from the very beginning. And I know that I think it was one of the teams that was up here. I think it was Amy from JVS who was saying, like, we need affordable housing. We need Medicare for all. There are so many things that we need to be fighting for in this moment, but we need to make sure that our people can stay here. And so we have been fighting on the Boston City Council for more funding for legal services, for a lot of the organizations that are here to help support the heavy load caseload that a lot of folks have. Shout out to the Mayor's Office of Immigrant Advancement. I see Hannah and Courtney here for the work that they're doing. I think it was last week. I don't know. Everything's a daze right now. But I was able, I spent 2 months convening some of our powerful philanthropic organizations here to get them to meet this moment, so that we are not walking this moment alone. So we were able to get the Boston Foundation, the Barr Foundation, and United Way to the table to commit to more than $3.1 million in new funding for immigrant serving organizations. And just so you know, the applications right now for the Boston Foundation are live at this moment. So if you are an immigrant serving organization and you want to apply for grant funding, go on the Boston Foundation website. We also have the information on our Instagram page, Rootsy for Boston, on Facebook. You can email my office, rootsy.louisiane@boston.gov. The Boston Foundation grants there, they focus on a number of things: weaving community well-being, legal assistance, and some other needs. So if you qualify, go out and apply. If you have questions, if you want to make sure how can you strengthen your application, I'm here. The Mayor's Office of Immigrant Advancement is here to help make sure that you are able to get the funding that we fought really hard for. Because, in this moment, a lot of organizations, the energy that a lot of people brought to this fight in 2016, we're not seeing again. We don't see it. And so we've been out here really on our own. And what I always say is that, like, I'm trying to make sure government can meet to this moment. I'm trying to make sure the big organizations can meet this moment. But we know that so many of you are on the ground doing the work, regardless of whether we give out grants or not. Regardless of whether you get the support that you need, because this is work. This is about life and death for a lot of our community. So I just want to say thank you. Continue to reach out to us if there are things that we can do from the city level, city council, in partnership with the mayor, by pressuring the mayor's office, whatever we need to do to make sure that we are getting what we need. And the mayor's office has been a great partner with me in this work. We were able to get the philanthropy to the table together. She's been a great partner in standing up and standing in solidarity with the Haitian community. Right now, I know this morning earlier you heard from the very devastating story from Presner and Presley about the loss of their brother due to a toothache in a country where nothing like that should ever happen. And my heart continues to ache for them, for their mother. But I hope you also saw this morning how in awe so many of us are about their willingness to use the pain of their story to make sure that that doesn't happen again to anyone held in ICE detention. an irredeemable agency that is robbing us of our brothers and sisters and of our neighbors. I have an op-ed out in the Boston Globe today that talks about the sadness and the heartbreak of that situation, but also connects it to TPS advocacy. And I want to shout out Brian. I know we heard from Brian today. We are, I think, only 19 signatures away. 19 signatures away from forcing a vote on temporary protected status for Haitians. It is urgent, it is dire. Next week, we will likely be having phone banks at Ula Cafe, but also on my Instagram page, we have graphics. If you have 30 minutes to call members of Congress next week and tell them to sign the petition, it will make a huge difference. We already have, I think, 3 Republicans who have signed. 3 Republicans have signed. This is a bipartisan effort, right? And we were able to show the White House that this is a bipartisan effort. We do not want TPS to end. So I just want to thank everyone so much. I want to thank Emily in my office, who's basically Haitian now. Emily, shout out to Emily. Her Creole isn't as good as Brian's yet, so you got to get to Brian level Creole, but she really carries the heart of the community with her as well, and I couldn't do this without an incredible staff, and without so many of you, some of my family, my cousin was here, she just left, but so many of you, family, either in real life or family in this work, I want to thank you. And I just want to I know they were here this morning. The memorial service, we had a vigil Wednesday night, but there's a memorial service next Saturday for Emmanuel Damas. It is incredibly important, those who are able to show up for the family and show them that we condemn what happened to them. Shame on this country for letting that happen to Emmanuel Damas, and that we can surround them with love. Please do so next Saturday. There's the time. So it's actually going to be at the Boston Teachers Union. Shout out to our unions. It's going to be in Dorchester next Saturday, March 28th, the same day as the No Kings protest. So feel free to come to the memorial service, and after go to No Kings. I'll probably be making the same journey. At 9:30 to 11:30 is the viewing, but it's I think I'm okay saying this. It's a closed casket, but it's going to be an opportunity for everyone to be and surround the family with love. At 11:30, from 11:30 to 1:30 is the memorial service, where we'll remember Emmanuel Damas. You'll hear from his family. You'll hear from some elected officials, and we'll remember and we'll say never again and not in our name. And then there will be a repass after. So it's basically from 9:30 until 4 p.m. at the BTU in Dorchester. Feel free to reach out to me if you have any questions. I've been working with the family very closely. Just couldn't make it this morning because of the hearing. Feel free to reach out to Emily and everyone. Thank you to all of my fellow, in Creole we call each other combattants. So thank you to all of my fellow combattants in this work. Thank you.
We are so grateful to you, Woodsy, because again, like I said, we text every day. Whenever there is something that is going on, so Woodsy will text me and Pastor Kiki, what's going on, what's going on? And we quickly let her know exactly what's going on, and then she can bring that to whoever needs to hear it so that they can really fight for it. And then we are so grateful for all of the work you are doing with the philanthropic community. Talking about the philanthropic community, we do have some members here with us, and I would love if they could quickly come. Just tell us in a few seconds, because we know time is flying, in terms of what exactly we are doing at the philanthropic level to make sure that we have the resources that we need to do the work. I know Imagodei is in the room. Imagodei, where are you? Come forward. And I know that we have the Heinz Foundation. Come forward quickly. And then we do have, where is City of Boston? City of Boston, we need you to give us a quick update on, the grants. Where are we? Because again, we are here to access resources. And we, Mass General and Brigham, HUS, are you here? I know HUS was supposed to be here. Come forward quickly. And if there is any funder in the room that I am not mentioning, please, just to tell us in 2 words, what's going on, what are you working on, what do you see? Quickly.
Hello everyone, my name is Paola Miranda from the Heinz Foundation, and we're working to fund projects all over Massachusetts doing community organizing. If you have a project, if you have an organization that is really building pathways for leadership for your community members. We are also offering infrastructure grants for projects around communications, around digital security, nonprofit sustainability, legal support, all of that. So if you have any questions, feel free to reach out.
Sheila Letty with the Imago Dei Fund. This is my colleague Sharon. We are in deep listening mode. We are continuing to do general operating support for a number of the organizations in this room, including IFSI. We also continue to support our churches at the local level, and are really interested in those bridge building opportunities. Support some of Brian's work. So we also have that link between the local and the international. But in listening mode.
Quickly talking about Haiti. So we have the Haiti Education Network team. They were supposed to present, but unfortunately time. Mr. Gabo, can you wave? So they do a lot of work in Haiti. So please connect before you leave.
Courtney White, Director of Constituent Services with the Office for Immigrant Advancement, joined with my colleague Hannah, who is our Legal Access Project Manager, and Nicole, who is doing her placement with us as an MSW Fellow. So as Councillor Louis-Jean said, we're really grateful for this public-private partnership that has enabled more grant funding to go to our immigrant-serving community members. So the funding through our office has been dispersed to our programmatic partners in the areas of weaving well-being, so non-clinical mental health, and legal access, as well as community-based support systems through mutual aid. So if you have any questions about how to get in touch with some of those partners, you can refer to the press release that was announced or contact Hannah and myself. We are also similarly in listening mode, really thinking about and hearing from community members what are the needs that you're seeing, what are the gaps, and developing our strategic priorities for the coming year. So we continue to want to take in all of your input, and we'll be working with the City Council and with the Mayor to determine our budget and then our priorities for the next year. So be in touch with us. I'd say if you have not signed up for our newsletter, definitely do so you can be the first to hear about those opportunities when they open, hopefully in the summer. But don't hold me to it.
All right, that's good. Thank you. So we good? Okay, all right. So let's give a big round of applause to our folks, because again, for this work to be done, we need resources. And when we have funders who come to those events to listen, to hear the needs. So thinking about the churches, right? The help that we give to the churches, giving them this opportunity to really bring people together just for fellowship, just to have fun, just to share a meal. During this time, it is important because, again, we know that budget is always an issue. To bring people together requires that they have some money. But sometimes $500 can make a huge difference just for someone to cook the food and get people together. Because if we don't pay attention to what's going on, we are going to lose a lot of people. If they isolate themselves, they don't have anyone to really call them and say, how are you doing? What's going on? We're going to lose a lot of folks. So that's the time for us to build more communities. So I'm so glad that you are all here. But as you listen, think about those areas for our communities, especially the most vulnerable among us. So thank you so much. All right. Okay. We are getting close to the finish line. But one thing that we always do, and we're going to do that quickly by table, all right? Because again, at the end of the day, we want to make sure that you leave the room with at least one word. So what I'm going to ask you, if your table only has one or two, let's grab together, make the tables fuller, because the camera is going around to ask, one word that you want to leave the room with today. And as you are getting ready to leave, we're going to meet in the lobby outside for our big, picture moment, because again, that's what we're going to use for our newsletters so that we can share with you. But before we do that, we want to thank every single one of you. Jennifer, you might probably have to read for me.
Yes, we definitely want to take just a couple of minutes before folks leave to thank all of the amazing co-sponsors of our event today. We could not have done it without you all. And just to name them very quickly, we have Mass Immigrant Collaborative, Boston Medical Center, William James College, Lawyers for Civil Rights, Jewish Vocational Services, Mira Coalition, the Leah Zalman Center for Immigration Health Research, Immigrant Connection at Awaken City, Unite Boston, Brazilian Worker Center, Mabel Center for Immigrant Justice, International Institute of New England, Massachusetts Health Connector, Jewish Alliance for Law and Social Action, Save Souls Inc. and La Distinction Academy, City of Boston Energy Saver, the Hyams Foundation, and Mount of Olives Community Center.
Oh, you forgot there are a few. Two Alliance Center, I didn't read Two Alliance Center, Haitian Mental Health Network. Even when we said Williams College, it's we still need to think about the, you know. And when we said Mass Immigrant Collaborative, we talk about a network of 15 different organizations to which we are part. Lenita, Patricia, and all of us. So we are so grateful. And we also, if we miss a name, please let us know, because we know there are so many of you who are here. So we have the Milton Interfaith Group, always with us, always connecting us, always bringing resources to us. To all of you who are coming from different communities to help us during this fight, we are so grateful. And we also have someone who came from out of town. Mr. Gabo, where's oh, come here, quickly. Flying, guess what, guys? Listen to that. Somebody who had to fly out of town to come here. So that's important. We know what we are doing. Come here quickly. I wanted to make sure that I acknowledge your presence. All right. So, your name and where you are from?
Ronald Senville from Haiti, right? So we based in Springfield, Massachusetts, and we're doing a phenomenal job with like Haitian community, African, French community, and the Spanish community. So if someone like, that Springfield, because we have a lot of Haitian came from Boston and now to live in Springfield. Definitely we continue the job over there. Thank you for what you're doing here.
Thank you. All right, thank you. And again, we are ENB. We forgot to mention ENB. We already mentioned IDGH. But again, we have so many partners, so I don't like to name partners when I cannot make the full list. So if we are missing you, so please forgive us. It's just a mistake. All right. And also, we want to thank the entire committee. Committee will really work so hard to put this event together. If you are here, John, Eric, Teddy, and the entire communication team, if you are here, can we see you? Adam, can you see you, the communication team? Where's Eric? Eric, where are you? All right. So, yes. All right. Look at here. Cindy is here. I've been looking for you, Cindy. So lovely to have you with us. And Julie. So, where's Julie? Yeah, Julie, lovely to have you. And again, we want to make sure that we thank the entire team for the food, Wood region, and your entire team. Nali for the decoration, the heart and lung of IFSI, Miss Beatrice and your entire team, the social service team, all of you guys who really worked so hard to make sure that we could have this event today. So we are so grateful. So now we're going to go around the room. You need to think about one word for your table, your entire table. Think about one word. Okay, and the camera are going to go around so that they can take, one word or two words. Maybe you need to mix with this table right here. Let's mix with some table if we need to. Camera, my videographers come around because we're going to go table by table. So each table, please go and find another table so that we can do it together. Rafaela, go join them so that we can have one word per table. All right, one word per table. Everyone, one word per table. Okay, so we go. Who's ready? You ready? It has to be loud and clear. Come here, videos. Come quick. All right. You have yours? Okay. come here, guys. Come here, come here.
Stronger together.
Yes. Thank you. Here, here. You have your word? Connecting. Wonderful, wonderful. Okay. Jennifer, get one. Yes. Get one mic for the other side. Okay, are you ready? Okay, wait. Together. Courage, right? Okay, here. Collaboration. All right, let's go here. What is your word? Together. Say it again. Connect. Let's go here. Together. Community. Wonderful. Here.
Many hands make road light.
Okay.
Our word is hope.
Collaboration.
Yes. Our word is hope.
Collaboration.
We're feeling hopeful. Hope is our word.
Are you guys good? You good? You good? You have the word? Okay, let's go. Wait. Yeah. Yes. Let's go on the back. All right. What's your word? Oh, AFAB. How are you? Keyword. 1, 2, 3. Keep on fighting. All right, here. What's your word? Peace. Here. Okay, are you ready, guys? What's your word? Hope. Resilience. Okay. Just one. 1, 2.
Resilience.
Okay, that's what. Okay. All right. Did you have your words? Say it again.
Resilience. Hope, yes.
Okay. We did you already, right?
Okay, very quickly before we go, we do want to make sure we grab that picture, folks. So please don't leave just yet. We just need a couple more minutes.
All right. We did everyone? Okay. All right. So now, I know we're going to do. Yeah, we're going to do. Okay. So quickly, we missing one table? Okay, go. Oh, yes, come on.
And it's an important word.
Oh, important word. I cannot miss that important word. This table. Let's go. Revolution! What about here? Okay, come on. 1, 2, 3. Okay, we did yours already? Okay. All right, so guys. Oh, okay. Oh, sorry. Sorry. Oh, not further? Okay. All right. 2 tables. Okay, here. Powerful. Empowerment.
Faith.
Faith. What about you guys? Money. Okay, so we're going to, as I said, we're going to go outside for a big picture as a way to really showcase all of the work. On behalf of the Immigrant Family Services Institute for coming out today and for sharing your wisdom and your power with us today. So a big round of applause to each one of you. Woo! So again, we're going to go and do the big picture outside. outside the way that we used to do it. Let's do it. Let's do it. Let's go.